Welcome to Please Me, the award-winning bilingual sexuality podcast bringing you bold conversations and big clit energy. As a female host in a male-dominated industry, I'm thrilled to announce that Please Me is the #1 ranked sexuality podcast in the USA and worldwide. I'm Eve, your host, on a journey from trauma to sexual liberation. Join me and my guests as we dive into conversations around orgasm equality, self-love, body positivity, and essential sex education. Let's reclaim pleasure and close the orgasm gap, one empowering conversation at a time. Last week on the Please Me podcast, I sat down with Janae Paylette to explore how couples can reconnect to intimacy, reignite desire, and reclaim their creative power. She shares why desire doesn't disappear because of age, hormones, or time. It fades when communication breaks down and the body no longer feels invited into the relationship. Today's episode features Jennifer Fonseca of Liquivida, where we dive into women's health, hormone balance, and non-invasive vaginal rejuvenation treatments. Jennifer explains how these innovative therapies support vaginal health, boost confidence, and help women feel vibrant again. I also share my personal experience with her services and how energized and alive I felt afterward. If you're curious about vaginal rejuvenation, women's wellness treatments, or reclaiming your sexual health and vitality, this episode is a must listen. This season, I'm returning to the original format with weekly podcast episodes, plus the continuation of a fan favorite role play segment at the end of every episode. Always fun, always spicy, and not to be missed. Early access drops every Monday on Patreon with public releases every Wednesday on all major podcast platforms, so set your alarms. Want to ask a question for the Please Me podcast? Join the conversation on Patreon or subscribe to my Substack newsletter for exclusive content, behind-the-scenes updates, and an opportunity to have your questions featured on the show. You can also join the Please Me Health Collective on STC.com, the world's premier ethically non-monogamous platform for swingers, polyfolks, and more. Use code 37340 for a free trial membership and access to my growing community, including free monthly webinars. Please Me is for mature audiences, so sit back, relax, and surrender to the pleasure of Please Me.
They were on the brink of losing their relationships because issues with sex or intimacy created dysfunction within their dynamic that it truly had to be addressed. So helping them kind of work through. But I was getting a lot of women that says, okay, well, my doctor, my GYN just says it's depression. They gave me this pill for that. Or they say it's anxiety. Here's a pill for that. And it's like, instead of taking in and listening and understanding holistically, what is the anxiety? Why is it because you're working too much?
Ladies, whether you are just starting your menopause journey or well into it and have questions about hormone replacement therapy, you're not alone. Many women experience vaginal dryness, decreased sensitivity, and urinary incontinence, like leaking when you sneeze, laugh, or exercise. These symptoms can be frustrating and limiting, but they are also very treatable. I experienced this myself and decided to try Parlor Game's topical estrogen and progesterone creams. Within 1 month of consistent use, my incontinence completely resolved. Topical estrogen helps restore tissue health, improve sensitivity, and support bladder control, while topical progesterone supports hormonal balance. If you are ready to stop suffering in silence, check the show notes for the link to Silky Peach, the topical estrogen cream, and Vibrant Third, the topical progesterone cream. I feel relieved and confident again, and I know you can too. I love wearing a bra, said no one ever. If you're tired of discomfort and want a great bra alternative, I highly recommend Cakes. I gave up bras during COVID and searched everywhere for something better, and Cakes is the best solution I've found. They offer adhesive, non-adhesive, and push-up options that give a seamless look under your clothes without straps or discomfort. If you're tired of racing to your car to pull your bra off at the end of the day, it's time to get your Cakes. I haven't looked back, and I know you won't regret it. Check the show notes for the link.
This episode is brought to you by Cologuard. Do you know what's really scary? Not screening for colon cancer when you turn 45. The Cologuard test is non-invasive, requires no special prep or time off work, and ships right to your door. In just 3 simple steps, Cologuard takes the scare out of colon cancer screening. If you're 45 or older and at average risk, ask your healthcare provider about the Cologuard test. Cologuard is available by prescription only. Learn more or request a prescription today at Cologuard.com/screen.
Baseball is back, and the first pitch is on Netflix. The New York Yankees, led by seven-time All-Star Aaron Judge, head to the San Francisco Bay to take on Rafael Devers' San Francisco Giants. This season kicks off with one exclusive opening night game. Watch MLB Opening Night, the New York Yankees versus the San Francisco Giants, live on Netflix. Wednesday, March 25th at 8 p.m. Eastern, 5 p.m. Pacific.
Halliday presents, in the red corner, the undisputed, undefeated Weed Whacker Guy. Champion of hurling grass and pollen everywhere. And in the blue corner, the challenger, extra strength Halliday. Eye drops that work all day to prevent the release of histamines that cause itchy allergy eyes. And the winner by knockout is Halliday. Halliday, bring it on.
Hello, and welcome to Please Me, the podcast that aims to destigmatize conversations about sex and sexual health by turning the sheets into our classroom. Today, I'm so excited to welcome Jennifer Fonseca to the show. She is a doctorate-prepared nurse practitioner with over 30 years of experience in healthcare, specializing in women's health, hormone optimization, and integrative therapies for sexual wellness. She is the co-owner and clinical leader for a comprehensive health and wellness modern practice in Wellington, Florida, called Liquivida Wellness, along with her husband of 17 years, Manuel Fonseca, who happens to focus on men's health and wellness. Dr. Fonseca focuses on blended therapies that help deliver personalized, holistic care aimed at creating longevity, vitality, and confidence for women across the age spectrum. With a passion, advanced skill set, and training in aesthetics, hormone therapy, and sexual wellness, she dedicates herself to building upon the female experience in all stages of life, but enjoys the focus area of perimenopause and menopause. So with all of that being said, I want to welcome you, Jennifer, to the show today. How are you today?
Thank you. I'm great, Eve. Thank you so much for that warm intro. I'm happy to be here. Excited.
Yes,
I'm excited.
I'm so excited to have this conversation with you today. It's going to be amazing. And I just want to put it out there from the beginning that I am one of your clients, and I did a treatment for vaginal rejuvenation. So we're going to be talking about some of that today. So we'll get into that in a little while, but I want to ask you first, why do you think that the topic of women's sexual health is still not really a topic that's discussed within the medical community and at large in society?
I think that's a great question. I think for the longest time, it's always been a taboo area. And there's been sort of this expectation that as we age, we're only good for those reproductive years, or when we're young, healthy. After we kind of have kids, it's like everything's expected to drop off. And it really is not the case, as we're learning more and more today with people taking, their own health and wellness, themselves, and trying to improve upon their well-being. They're learning ways that they can really get themselves healthier and have therapies that really contribute to help them feel the best versions of themselves. So it's a little bit to do with just how medical training was, initiated, way back when, to how it's kind of shifting now, and the therapies that are out there. Essentially, if you're not getting your sexual wellness needs addressed with your primary care provider, which is not routinely something that happens, maybe if you're fortunate, you have a very thorough, OBGYN or GYN provider that can help, with those things. But typically they're more focused on disease stages, not so much the general wellness. And so sexual wellness kind of falls in between those categories, where it doesn't really get a lot of attention. But thankfully, there's therapies outside of that we can focus on that can really help to improve upon those areas.
Absolutely. It's sort of like an adjunct education for nurses and doctors that they have to actually go seek, because in medical school or in nursing school, sexual health is not really covered too much, right? And so unfortunately, OBGYNs really focus on fertility, not necessarily the later stages of a woman's life, menopause and perimenopause. And so oftentimes we're walking into those doctor's visits thinking that we're going to get some answers to our questions. And sometimes they just look at you with a blank stare because they really don't have the education. And so when you get that higher education, that is when you can help people in this arena. And also, when you're talking about medicine, unfortunately, many of the studies that have been done in the past did not include women as test subjects. So how do you treat somebody when you're not testing them and you're not gathering data? Data is so essential, right? And so I think those things are starting to shift a little bit and change, which is wonderful for us as women. And so I want to ask you about what the concerns are that the women come to you with. What sexual health concerns do they have when they're coming to see you in your practice?
Yeah. So interestingly enough, when I first started into this wellness realm several years ago, I was having a lot of women that were coming in just mainly complain about the physical changes that they were seeing and not quite knowing how to put labels on what they were experiencing. So generally speaking, I'm a pretty open, receptive provider, and I can read in between the lines well when I'm seeing patients. So if they were coming and they were saying, I don't feel confident, I don't feel attractive, I've put on this weight, my desire for intimacy is in the negative. And then we start kind of honing in on more specific questions. Are you able to climax? Are you getting wet during arousal? Are you satisfied with your sexual wellness or your, sex life? And then those sort of things start to kind of open up. But generally speaking, it's more to do with hormones than anything else, which really is the foundational, area for improvement. Once we have that, kind of locked in, solid, strong, you can build upon that. So in general, as it relates to hormonal changes, can be, laxity, dryness, difficulty achieving orgasm, painful intercourse, sometimes even things that will come in between, a comfortable interaction for sexual intercourse. So it's really a lot more common than people are led to believe. We just don't tend to talk about it as women, especially when there's something wrong. You're happy to share things when things are great. You have a great date, you have great encounter even. But when there's something wrong, it's kind of like this almost shame or embarrassment. And so if you don't have the space to kind of open up or have somebody guide you or educate you on what's happening with your body, very difficult to put it together yourself.
I love that you mentioned hormones because hormones are so essential to maintain an optimal level throughout our lives. And oftentimes doctors will say, oh, no, you're, still in perimenopause. You don't need any hormone replacement therapy. Wait until you're fully in menopause. But perimenopause can last 10, 12 years. You know what I mean? And so you're suffering for 10 or 12 years before your period completely disappears, which is something that did happen to me. And so how do hormones impact women's sexual health across different stages of their life?
And you brought up an excellent point, Eve. So with perimenopause, there's a lot of misinformation out there to say that, say within normal limits, your blood ranges or your blood tests are within normal limits. It's like my pet peeve to hear.
Yes.
Because if you have somebody that is coming to you and they're saying, I feel off, I don't know what it is. It doesn't mean that we get to negate whatever it is because we don't see it on paper. I tell my patients all the time, you're in the neighborhood, but we have to figure out what house you need to be at. Every one of us has to be at a specific location in order to feel like we're optimized in that arena. So with all that being said, perimenopause is still getting a lot of light, all to do with, environment, the foods we're eating, the things we're exposed to, deficiencies in vitamins. There's so many things that affect us. But it's getting more light now to have women understand that brain fog is not just something that's in their head. It's not because it's associated with all types of stress and work or what have you. Things like weight changes, things like dry skin, the very, joint pains, headaches, the very common symptoms that we tend to say, oh, it's because of this or because of that. It's truly our body speaking to us saying, hey, I'm going through a shift. I need some added attention. So if you're not mindful and you're just kind of putting that to the side, you really don't get that moment to realize that there's something wrong that needs attention. So perimenopause is one of the biggest focus areas that I enjoy because again, you can put a label on it. And once women can understand that and take back kind of their power, their sense of being, and optimization, that it's a game changer for all things moving forward.
It 100% is. And, when I think about my journey, my perimenopause and menopause journey, I think about, the doctors that have said, oh, well, your blood work is normal, right? And you mentioned that was a pet peeve of yours. And of course, if you are in perimenopause or menopause, your normal is going to be that your hormones are low, right? Or dropping lower and lower as the years go by. And that is technically normal, but it's not optimal. And what we want is to maintain optimal health in order to maintain our function and reduce all of those symptoms that you mentioned, the brain fog, the painful joints, all of the things, hot flashes, sweating at night, all of the symptoms, that people may experience. And for me, I love to just talk about my experience so that people can understand that, they're not alone out there, right? I had an unwanted surgery to my hip because I thought there was something actually wrong with my hip. I went to the doctor, they did an MRI, they said that I had a torn labrum. And when they went into the surgical procedure and they looked inside my joint, they said, your joint is totally normal. You have no arthritis. Everything looks good. We just opened it up and we closed it back up again. And I had an unneeded massive surgery. This is my hip we're talking about here, right? It's not a tiny, it wasn't like a hip replacement or anything. They just opened it and closed it back up. But you're putting yourself at risk for infection and, complications, obviously, anytime you go under the knife. And all for nothing because I was misdiagnosed during my perimenopause years. I had hip pain for years and years and years. And who knew that this was actually being caused by low hormones? And so as soon as I started hormone replacement therapy, the pain decreased by 90%, 90 to 95%, depending on the day. I mean, I'm not going to say that it's 100% better because every so often it comes, it shows its ugly face again, and it's like, hey, here I am again. Like I'll step on my right leg and I'll be like, ooh, that hurt. But for the most part, the pain is almost gone. And it was because I introduced hormone replacement. And so let's talk about that just a little bit in terms of your practice, because I go to a specific hormone doctor, et cetera. But when a patient comes to you and they're complaining about hormone issues, do you send them somewhere or do you send them to a lab to get hormones done? And do you order them yourself? What are we looking for?
Yeah, then that's a great question. So typically when folks come in, we're doing a thorough assessment. What are the concerns that you have? And then I pair that with, an extensive blood panel that we order. And so what I'm looking for, inflammatory markers, your thyroid, kidneys, liver, like all the basics, things that are routinely checked in, say, your primary care provider's office, but most specifically the hormone panel. So between your estrogen, your progesterone, your testosterone, vitamin D as well, those all work synergistically. And sometimes when those levels are low, again, people are optimized at different points in that. But when those levels are low, those can definitely cause some of those symptoms. So what you're doing is you're identifying what those numbers, what those values are, to then say, okay, we're going to try to supplement, whether it's by way of pellet, by way of injection, sometimes oral creams. There's multiple therapies. Not one is better than the other. It's just what's specifically great for you as an individual. But once you start out with that, low and steady always wins the race, is how I say. You're looking to see what's the amount that's needed to basically minimize or get rid of the symptoms that brought you in to begin with. So, again, can vary from person to person, but that's a very important piece that a lot of traditional medical providers, won't look at or won't follow. And not to say that they're bad providers, it's just their training is just different. And now we have gone into the shift in the wellness space where we are, as consumers, educating ourselves more and more to understand what it is to really be optimized. So we're not just being reactive, we're trying to stay proactive to keep us, with vitality, longevity, feeling as healthy and I want to say youthful. I don't know if that's really the right word, but just as best as we can, for ourselves, which is great. So we do the labs in-house. We'll send it out, and then I will follow up with the person to have them come back in and say, this is the objective data I have. These are the ranges, that we're kind of looking at. Let's start some supplementation and see what improves by there. And then from there, we can gauge, how much is needed, what type of therapy, if one is better than the other, and go from there.
Excellent. And I love that you mentioned multiple different ways of getting those hormones into your body, right? And so I'm going to just mention here the type that I was using. I was using a troche, which is created in a compounding lab and or a compounding pharmacy, and then it's mailed directly to me. And I had to put, it's kind of like a little jelly square on my gums. It's called a troche, and it just absorbs into your bloodstream through your gums, right? So for me, I had a really bad reaction to that because it caused really bad taste in my mouth. And I complained to them multiple times. Each time I had the appointment, I was like, let's try a different flavor. Let's do no flavor. Let's try, because it would leave my whole tongue coated with the troche stuff, right? And and then, I would put it on at night. Or I would use it at night. And then in the morning when I would wake up, I would have like the worst taste in my mouth. And when I was brushing my teeth, it would actually make me gag. And because the taste was just so gross, right? And so this last time, my last appointment, I brought it up again. And I said, I really can't stand the troches. I can't believe that I have to use these for the rest of my life. And they said, oh, well, you can, instead of the troches, the oral ones, you can do a vaginal suppository. And I was so excited. I said, please switch me to the vaginal suppository. And I have been using those, and I absolutely love them. And it's not obviously affecting my mouth anymore, so I'm not gagging in the morning. And so that's another method of getting hormones into your body. And the ones that I use are contain testosterone, progesterone, estrogen, and DHEA. And so it's all in one, which is a really easy, neat package. So I want to just mention that to you as well. I want to talk a little bit about the different types of treatments that are available for sexual wellness. What sorts of treatments, and I do a host of them in my physical therapy practice, but they're going to be different from the ones that you do. So I would love for you to kind of tell us what different treatments you offer in your practice, and just tell us a little bit about each one.
Yeah. So I recently, after thinking long and hard, I wanted to implement something that was not, that was multifaceted in how it approached it. And I was most interested in the functional wellness portion. So knowing that I have close girlfriends in my circle that are in their late 20s, early 30s, and having issues with urinary incontinence. They can't get through an exercise routine without making sure that they're wearing a panty liner. And
so young.
Yeah, so mindful, but they also had a pretty large baby. So that vaginal, laxity changes, the pelvic floor changes. Everybody's going to be different. It's not that there's anything wrong, but it's okay. This is what you're going to need to get you back to, normalcy, where you feel comfortable and you feel like you can manage your day-to-day activities, without any issues. So, in that case, we can do the V-Tone. The V-Tone is a device that helps basically to strengthen that pelvic floor. It's more contractions and your brain can literally process doing on its own. And so you have that, added strength, and it helps to strengthen those muscles so that it's obviously, I want to say, what's the word I'm looking for? Contracting, but it's not painful. So just helping to really tighten up those areas. Or if it's something where we're dealing with, some vaginal dryness or some laxity, there's also the Forma V, which looks like a probe that's heated on one side that basically works to heat up the tissues inside, and it helps with tissue remodeling so that it's generating more healthy tissue. Or the Morpheus vaginal treatment, which is radiofrequency microneedling. Also can help with laxity, vaginal dryness. If you're somebody that suffers from chronic urinary tract infections, common bacterial infections like bacterial vaginosis, it just helps to kind of create a healthier version of the tissue within that space. And then, of course, because it's helping to build collagen, can also help to create, tighter tissue, which can be quite beneficial in both, from a functional standpoint and from an intimate standpoint, especially if there are things that you've noticed after changes, were starting to come into play and really becoming bothersome.
Yes. And so far in your practice at Liquivida, I received 2 of those treatments, right? The first one was the strengthening one, which you called V-tone. Is that what you called it?
V-tone. Uh-huh.
V-tone. And just to explain it a little bit for people out there, if anyone has ever had used a TENS machine and they put it on their forearm, for instance, here, and it causes contractions of the muscle. So when you insert it vaginally, there's a special insertion wand that you put inside. It causes the muscles of the vagina to contract. And I have to say that I walked out of that appointment feeling everything down there. Normally I'm walking around and it's you don't feel anything, right? It's just your body part is there. You're not paying attention to it. And it's just there. But when I walked out of that appointment, I could feel everything down there. I was like, woo, I'm awake. I'm alive, Yeah. And it was actually a really good feeling. It just felt like it had been woken up.
Yeah.
It was not painful at all. It was not painful at all. It was definitely, the contractions were way more than I could have done with Kegels on my own. And definitely, I don't remember how long the treatment was, but it was not a long treatment. And it was just contracting the muscles, and it really did wake everything up down there. And then I got the other treatment that was the light treatment, right? And so can you just explain a little bit, because the other one I kind of understand more, right? Because it's sort of like a TENS machine and it makes the muscles contract, right? You're sending electric signals to the muscles and then the muscles are contracting. So the other one was a light therapy, and I think it was a special type of light. Can you just explain that?
So the Forma V, it's more like a heating probe that helps with tissue remodeling. So think of it like before your exercise, you're kind of going in, you're stretching to make sure those tissues are nice and prepped and ready. And while that remodeling is happening, be it from the V-tone, from your radiofrequency microneedling, it's kind of getting ready to start, building more collagen. So it's kind of like laying out the concrete before you start doing the work on top of that.
Okay, which is why you did that first.
Yeah.
And isn't that a red light there? Was it a red light therapy, or am I thinking that I'm thinking something else?
No, just a heating element.
Gotcha.
Yeah.
Okay, gotcha. For some reason in my mind it was like a red light wand or something, but no. Okay,
Yeah.
it's hard. I wouldn't be able to tell because it was inside. So I was thinking it was giving me red light therapy, but no, it's not. It was just a warming. So you're warming up the tissue and getting it prepared. So you're really just bringing blood flow to the area, because the warming is going to bring that blood flow, right?
Correct. And then depending on the type of treatments you do, it's very common for folks that have the Morpheus vaginal treatment, which is a radiofrequency, that creates a lot of micro channels into the vaginal space. So if you're coating it, say after treatment with exosomes, that can also help tenfold by increasing that collagen that's going to be built. So if it's, again, an issue with dryness, an issue with lubrication, painful intercourse, sometimes it's just looks. I've definitely have had women that are like, okay, I've been on these medications, or I've lost this weight. I finally got my body the way that I want it to look, but down there things have changed and I don't really feel comfortable getting undressed in front of my partner or partners. Is there something we can do about that? So whether we're doing, fillers, I've had women that come in for dermal fillers of the vaginal lips, for example, because, as time, laxity will change that appearance. And then just like I've had women with the Morpheus in how their vulva looks, they're not quite happy. So the Morpheus can definitely help to tighten that tissue as well. So it's just, again, a very multifaceted approach. It's just a matter of what is most concerning for you. And these are the things that we can do to help, bring that back to a level of normalcy that you feel comfortable and your best self in.
Absolutely. And the Morpheus is the microneedling treatment, correct? And so this is the one that I did not get because you said that it was, you had to wait like a certain amount of time after the treatment. Can you tell us how much time that is before you can be intimate again?
So before intimacy, probably a good 72 hours.
Okay, that's what I remember too. Okay.
Yeah. When you're getting the Morpheus, keeping in mind that it's little needles to the area, and it sounds worse than what it really is. Thankfully, we don't have the nerves that come in through the vagina. There's the upper third, which doesn't really feel much, versus the lower third. So you definitely have some numbing to keep you comfortable. It is something that, can easily be done. But once you are done with that treatment, you will have some blood. So think of it like if you're menstruating, most women typically won't do anything intimate when they're menstruating. They will wait until it's all, done and over with. So you just want to be sure that you're not exposing yourself and, potentially creating infection after the treatment.
Yes, because you have to heal. So 72 hours. And so the reason that I said no was because I had plans and I within those 72 hours, and I was like, no, you're not going to ruin my good time, but I'm going to plan for this treatment for the future. And I have gotten a similar treatment for my face. It was like a quote unquote vampire facial, right? That's a similar treatment with the microneedles, right? And so you're just really kind of giving your body a little bit of, almost like little tiny cuts, right? But they're needles, right? And so you're making your body purposely like bleed in that area to bring more nutrients to the area to then heal itself and to cause the area to sort of get tighter, create more collagen, and get the tissue become healthier.
Yep, the collagen building. So the body essentially recognizes that there's an injury and it's going to prioritize healing that injury before it does anything else. So even if you were to do just the microneedling, which radiofrequency microneedling is different because it has the added heat element. Traditional microneedling, like a vampire facial, is just going to have the micro injuries to the face, for example. But when you're doing RF microneedling, you're adding a heat element. So it's a lot more intense, if you will. But, with all that being said, you can get, into that treatment and start to feel and see those changes. After the first one, usually we'll take a series of 3, but you'll start to notice some changes within 4 to 6 weeks of the first treatment. It'll be slight. You'll get the most changes come the third treatment or after, because some women, may need more, may need less, depends on their concerns. But typically after 3 treatments, it's a good start point.
Fantastic. And I know that for a lot of women, these concerns are definitely a little bit scary to bring up. And, you had such a great bedside manner with me when I went to go see you in Liquivida in your clinic. And I would love to just know how you create a safe space for women so that they can be comfortable talking to you about these experiences and their concerns.
Yeah, I love that. I've been a provider, oh my gosh, since before I can remember. I've been in nursing a really long time. And so you get to learn people and just in your way to talking with them. I've been told I'm very warm, approachable, receptive. There really isn't much at all that surprises me. And I, obviously in a clinical space, it's not, for anybody to judge. You tell me you want to be out and be the best looking adult film star. Great. Let's get you to it. Tell me what you need. We're working on that. You tell me it's just about, intimacy or getting back in the dating scene after your divorce. Great. Let's talk about what you need for that. So it's really helping them to know, obviously female to female, it's easier, I think, to talk to somebody that has the same body parts. And also I've shared some of my personal experiences as well, with my own shifts in perimenopause and how that sort of affected me, be it from sexual standpoint, from, menstruation standpoint, and kind of what therapies were given to me, what wasn't given to me. And then the fact that I'm able to kind of put a label on things that they're likely experiencing based on the history and information they gave me or on the labs that we're looking at. So a lot of times it's more of like, okay, I see this. Are you having this? And they kind of look at you like, oh my gosh, how did you know that? And I say, okay, well, this is what it's showing me. Let's talk a little bit about what it would take to get you to feel comfortable and feel well, with whatever it is that you want to do, be it sexually or just, altogether, again, wellness. So it's just creating that space, letting them know there's nothing that's going to surprise me. I'm totally receptive. Whatever you need from me as a patient, we're going to talk about it. And I tell folks, if it's enough to bring you to someone's office to discuss it, definitely enough to be addressed fully.
Yes, absolutely. And I think that women are starting to take, our health into our own hands. And I think people in general, because there is just so much more information, we're bringing information to our doctors and saying, hey, we have a lot of questions here, and demanding. And I always say, create questions, be ready for your appointments, advocate for yourself, because that's the only way that you're going to really get your medical needs addressed fully. Because, a lot of times doctors only have a certain short amount of time to spend with you. And if you're not prepared during those 10 minutes or 15 minutes that you spend with your doctor, you are not going to get as much out of the appointment as you would like to. And when you get home, you're going to be saying to yourself, oh, I forgot to ask him this. I forgot to ask him that. And by that point, it's too late, right? Trying to get them via email is not always the easiest thing. And you have to go through all these portals and all of this craziness. So be prepared for your appointments. Make sure that when you do have an appointment, you are prepared and ready with your questions so that you can, get all of those, issues addressed. And so I want to talk a little bit about lifestyle, mental health, and stress. How do those things affect our sexual health as women?
That's a great point, because I was just about to say it. Sometimes in traditional medicine, it can feel very transactional. And
Yes.
so when I started again in the space, truth be told, I started because I was most interested in aesthetics. And the location where I was working happened to be very focused on hormones as well. And if I'm going to be honest, hormones was not, it was not what brought me excitement back when I was doing my program for my master's. And so I had always kind of like put it off to say, somebody else can deal with that. But what I was finding was really I was empathizing with a lot of the women that were coming in. They were on the brink of losing their relationships because this, issues with sex or intimacy created such a dysfunction, within their dynamic that it truly had to be addressed. So helping them kind of work through. But I was getting a lot of women that says, okay, well, my doctor, my GYN just says it's depression. They gave me this pill for that. Or they say it's anxiety. Here's, a pill for that. And it's like, instead of taking in and listening and understanding holistically, what is the anxiety? Why is it? Because you're working too much? What kind of stress is it? What can I help with? What can be addressed? It's again, that functional medicine piece that looks at why is this happening, finding out that root cause to then address it holistically. I can medicate you all day long, but if I'm not truly addressing what is causing you massive anxiety, that medication is just going to pretty much shut that system down. And so that's, I think, where a lot of us kind of fall victim, because we start to think it's been gone, I haven't had it, I'm too busy with all these other things, there's no point in addressing it. But really, it's not that the pleasure or desire goes away, it's just that it's buried underneath, all of our obligations. And so as females, because we tend to cater to or take care of others, before ourselves, it can be a very slippery slope. Because by the time you realize you've raised your kids, they're out of the house, you have your partner, you're always working, what have you. And then it's like when you're ready to gain, bring that focus back to yourself, you're like totally different from where you started, years prior. And that can be a little bit frustrating. So it's very important when women come in, at least for me, understanding who they are as an individual. It's not a transaction for me. It's not just about a sale and say, hey, this is a treatment you need. Here you go. You pay for it. Off you go. Call me if you need me. It really becomes a partnership. Like I tell my patients, I want you to look for your providers as if you were dating. And if you're on this website and you're going on this date and you're saying, okay, this person doesn't speak, the way that I like, or can't hold a conversation, or is not interested in what I'm saying, you're probably not going to go on date number 2, let alone number 3. But if you're going in and you feel that vibe and that connection, and that care and concern, that empathy, more than likely you're going to be coming back. And then it becomes more of, okay, yes, I'm your provider, but I want you to think of stepping just outside that traditional box a little bit and just open up to me the way that you would to any person you trust in your circle, knowing that I'm, looking for the best outcome for you to help address the things that you need, and need to be resolved.
I love that you mentioned that hormones were not something that you were even interested in, right? initially. And what's amazing when you are, a medical provider is that you can go through many stages in your career, and you've been a nurse practitioner for a long time, a nurse for a long time. And I too have been a physical therapist for over 20 years. My original specialty was not sexual health. It was pediatrics, believe it or not. And when I moved to Florida, I started seeing adults because there weren't as many pediatric jobs. And then I honed in on sexual health. But, it's interesting that you were not so interested, but now that's really something that gets you fired up and excited. And maybe too, because you're going through it yourself, right? You said that you were in perimenopause. And when you're going through it, you can really empathize with your patients,
Yeah. I tell patients it's, now if you have a problem with the partner, I can't fix the partner as much.
Right.
Unless they happen to be, wanting to come in for hormone optimization. But generally speaking, there are things that, again, we can look to optimize within yourself just so that you're feeling better. The best version of you is how I say. And then from there, it's, pretty smooth sailing. But it's initially finding the provider that you kind of connect with to make sure that you're addressing all those concerns. Because if I wasn't a medical provider myself, I would be just as confused, overwhelmed, in this space. There's just so many therapies, so many myths, so many things that you can do, not do. Again, you have to have a trusted provider that really has, your best outcome, like your outcome in their best interest, right? To help address it and get you to feel better, to feel the best version of yourself.
Absolutely. So finding that provider that you're going to want to go back to over and over again to really take care of you for years to come, right? Because I know some of my, doctors, I see once or twice and then I don't see them again. But the ones that I really love, I see years and years. And so finding the ones that you really can connect with is really important and essential. So that brings us to our role play. And I'm excited to do our role play today. We are going to talk about, well, I'm not going to say what it is just yet, but I'm going to be playing the man. So excuse me if my voice is not deep enough, but I'm going to be playing the man. And Jennifer is going to be playing the lady. And we are going to be talking about, I think this season, what I think I want to target is things, communication between partners and how to introduce something new in the bedroom, whatever that may be. It doesn't have to be a toy or anything specific. It could be a position. It could be, a new idea or role play that you want to do. So just different things that we want to introduce. And so we're going to be modeling those conversations. And so Jennifer is going to be the lady and I'm going to be the man, and we are going to have our role play. Any questions before we get started?
No.
Okay, perfect. So we're going to start now. And action.
Ladies, let's get personal for a minute. What does your vaginal health routine look like? Because as we mature, our intimate self-care needs an upgrade. If hormone shifts have you feeling dry, less sensitive, or just not quite like yourself, I've got a simple 3-step protocol I'm loving. Every morning I use my lady pump to increase blood flow and wake up the lady bits. And yes, it comes with 3 attachments for all the sensations. Then I apply Shamelessly Aroused by Shameless Care, formulated with sildenafil, the active ingredient used in Viagra, to support stronger arousal, better lubrication, and more responsive orgasms. Pair that with a daily self-love ritual, and you got a powerful daytime combo. At night, I use Parlor Games estrogen and progesterone creams to support healthy hormone levels and resilient vaginal tissue. Fewer oops moments when I sneeze, and way more confidence when intimacy calls. Dryness, decreased sensitivity, frequent UTIs, incontinence, low blood flow? These 3 upgrades can be a total game changer, because intimate health isn't indulgent, it's essential. And trust me, you'll feel the difference. If you've ever wished sex could feel more connected, more intense, or honestly just more fun, you need to check out Shameless Care. They're a telemedicine company built entirely around sexual health, real doctors, real prescriptions, and products that actually work. Like Shameless Chemistry, their oxytocin plus tadalafil blend that deepens connection and boosts arousal. Or Shamelessly Aroused, a topical cream with the active ingredient found in men's ED medication, increasing blood flow exactly where it counts. Every order includes a short video introduction from your doctor, transparent pricing, and no subscriptions ever. Just real, sex-positive healthcare that delivers results. Because you're a Please Me listener, you can use coupon code PLEASEME for $15 off your order of any product on the Shameless Care website. Use the code PLEASEME, that's PLEASEME, at checkout to claim your $15 off. Again, that's shamelesscare.com, code PLEASEME. Because great sex shouldn't be complicated. It should be shameless. This episode is sponsored by Shameless Care.
Instagram teen accounts have automatic protections for what teens see and who can contact them, plus time management tools. And Instagram will continue adding built-in safety features to help create age-appropriate experiences. Learn more about teen accounts and Instagram's ongoing work to protect teens online at instagram.com/teen accounts.
This episode is brought to you by Redfin. You're listening to a podcast, which means you're probably multitasking. Maybe even scrolling home listings on Redfin, saving homes without expecting to get them. But Redfin isn't just built for endless browsing. It's built to help you find and own a home. With agents who close twice as many deals, when you find the one, you've got a real shot at getting it. Get started at redfin.com. Own the dream.
Hey, baby.
Hey, baby. So I've been thinking, I went to the doc today. The last few months, really, I just feel like something is off. I absolutely love our time when we're intimate and whatnot, but I feel like I'm just having a harder time climaxing. And when I see you, you're like so happy, satisfied, you pretty much pass out after we're done. I want that same sensation, and I'm trying to see if there's anything I can do to improve, from that avenue. So I wanted to kind of talk to you about maybe some treatments that I was thinking about doing and see what your thoughts are on it. Maybe from there we can start, looking at different positions or different, role playing, maybe some toys, things that we can bring into the bedroom, just something to help kind of, give me that satisfaction that you feel, when we're in the bedroom.
Well, first of all, I want to say thank you for telling me, because I definitely want you to have as satisfying of an experience as I have. And so I'm sorry that you haven't been able to climax and get there. And so I definitely want to do whatever it takes to help you to enjoy our intimacy as much as I do. So what do you have in mind? Do you have certain positions or ideas, or what do you want to do? Tell me what your thoughts are, since you've been thinking about this more than me.
So I was reading up on something called the O shot, which is essentially injections that women can get right into their G-spot to help stimulate that tissue, and basically promote more function, more sensation in that area. Okay. So I was thinking I was going to go in this week. I'm going to try out an injection. Can't hurt. Going to see what that's like. But maybe when we get back and it's, I've been cleared, which typically is just a couple of days, we can maybe get in and try some different toys that we can use. I was thinking we can head out to the adult store and see if maybe we can shop around, get some info, and just make it kind of like our date night. Instead of us doing, heading out for dinner, we'll just head out for some drinks and maybe go in the adult store and see what we find. How do you feel about that?
I think that sounds like a lot of fun. I would love to introduce some toys to the bedroom. So what sort of toys do you have in mind? Is this going to be something that's going to stimulate the area that you're getting shot? Because if you're getting some injections to a certain area to stimulate your G-spot, it's going to make the sensitivity more. Is that what we're going for here?
Yeah, it'll increase sensitivity for sure, but also just something to kind of spice things up, just to switch it up a little bit, because I feel like we've been, don't get me wrong, our sex life is good, but I feel like there's room for improvement. So just something where we can spice it up and bring something new into our space. So I'm probably thinking, I like when it's penetration, you and I, but maybe something like some sort of clitoral play, maybe if there's a toy that helps with vibration, or maybe see what it's like, while I'm stimulating my clitoris while you're penetrating me. I've heard that I was talking to another girlfriend of mine and she told me that was phenomenal. And so I really am eager to try, that and see if it's, gives me the same results. Cause the way she was talking about it, man, I'm ready to do it right now.
And we don't have a vibrator in the house. Let's try it right now. I want to try it right now. I want to see how that feels for you.
I don't think the electric toothbrush will cut it at this point. We got to wait for our date night.
We got to go shopping. I don't know about you, but our date night should not be in 2 weeks or 3 weeks or a month. It should be today or tomorrow, because this is something that I think is important, and I want you to be satisfied. So I am all for going shopping for our next date night, and let's make it sooner than later.
I appreciate it. I love that you are taking the time to really listen and not taking it like it's something that's wrong with you, but rather something that we can improve upon together. I appreciate that. It really means a lot to me.
Well, I'm unlike a lot of men out there, right, that don't understand that, my dick is not everything to every woman, right? And I understand that, women need clitoral stimulation, otherwise they can't orgasm. And so I want to make sure that you're getting that clitoral stimulation as well as the penetration from me, and maybe from other toys, whatever it may be. Whatever is going to get you there, that's what I want to do for you, because I want you to be happy in our bedroom. And obviously, that's going to make you happier overall.
I appreciate it. Thank you for listening, babe.
Thank you. Can't wait to go shopping and scene. That was fun.
So you think, yeah, it can be pretty normal. I think it's just once we take off the taboo. When I was much younger, in my college days, I used to have some close friends that, when they would link up with their person, or their people in some cases, they would want to start looking at adult content before they kind of got started. And that's truly, I don't know about anybody else, but I didn't have my parents coming to me saying, hey, this is a good position, this is not, or do it this way or that way. The focus is always, avoiding sexually transmitted infections, avoiding pregnancy, which obviously was a big concern. So it can be a lot of cultural changes there. But we, typically are not, as women, taught that sex can be just for pleasure. And so where we were reactive to the things that can happen, with that, we were doing a lot of experimentation. But my point is that a lot of these ladies were taking to adult content to really take a look and see, like, oh, is this what it should feel like? Should I look like this? We can try this position. We can try that position. And in some cases, obviously, their partners would be so excited that it would just kind of heighten, those encounters. And so there's really, when you're dealing with somebody, and I say dealing for lack of better terms, but be it significant other, not significant, occasional fling, whatever, you are, like you say, an advocate for yourself. And so just like men can come in and say, hey, I'm having issues with ED, it's messing me up mentally because I can't perform. Women are essentially the same thing. We're just taught that it's almost like a taboo, like you say, that we shouldn't be bringing it up because we're only meant for, reproductive years. And once we kind of fall off, it's just, this is part of life. So we really need to, take that stigma out from it being that, and it being more of holistic sexual wellness. Like, we're entitled to those amazing encounters, orgasms. Sexual wellness needs to be on point, because from when you go to perimenopause to menopause, you have a lot of life ahead of you. I mean, I don't know about you, but I want to be 90 years old and still, kicking it with my partner and saying,
yes,
best sex ever. How amazing would that be versus, having discomfort or pain because you think, oh my gosh, I haven't done it in, several years, and then life changes, somebody comes into your life or what have you, and now you're kind of having to start from scratch. So those are things that really help to keep you youthful in a sense. I mean, you think about the endorphins that are released,
yes,
it really
all those feel good chemicals. Absolutely. It does improve your mood. And so, and your life in general, so I think it's absolutely essential. And, menopause, the whole thing, you will spend at least 1/3 of your life as a woman in menopause. That is a big chunk of your life. So if you're throwing away your sexual health because, you're beyond your reproductive years, so it doesn't matter anymore, you are missing out on so much pleasure and so much enjoyment and so much happiness. We really do need to focus on our sexual health as we get older, because as you said, I want to be able to have amazing, mind-blowing sex well into my 70s, 80s, and 90s and beyond. If I can live that long, I'm going to be wanting to get, some pleasure. So absolutely, I'm 100% with you on that. So I'm going to ask my final question now. I want to know what message you have for women that are listening to this podcast to walk away with.
So the biggest thing I would say is take ownership of yourself. Don't let anybody tell you, just like we go in and we're looking for a black dress and you're shopping, store to store until the one that you find fits the way that you just love it. It should be the same thing with healthcare, especially when we're talking sexual wellness, your sense of vitality, confidence, find yourself the provider that you really can connect with and that can build on that relationship to make sure that they're addressing all of your needs. You're entitled to that. We as women, for many years, decades, have been kind of pushed aside to say, oh, it's because of this or that. These pesky hormones, why a lot of folks won't really dip into it. But you need to have that foundation solid. It'd be buying the house and working on the furniture before you're doing the floors. The hormones are the floors. Once that foundation is solid, you can really build upon that and things will just come naturally. So really own that, believe in that power of you, and make sure that you have access to the things that you need to be the best version of yourself.
I love that tip so much. And I want to make sure that all of my listeners can find you. Where can we find you?
So liquivida.com/Wellington is our website. And our Instagram, we do a lot of funny content on there just to show that we're human, we're relatable. We really do. We do a lot of heavy work behind the scenes, but our Instagram is liquivida_Wellington.
Okay, there it is right there. And I need to follow you on Instagram because I haven't done that yet. But yeah, absolutely. I want to follow you and reshare a lot of your content because I like to do that with people that I have guesting on my show. And again, you guys can find me as always on pleaseme.online. I have been working on my website and I'm so excited that my affiliates are all fully redone. So all of the links are there. I also have the things that I had mentioned in prior episodes that were not there, and they are now there, like the penis pump and the penis extender. Those are now there. So you can look on pleaseme.online on my affiliates, and you can check out all of the things that I recommend for my patients, and I also use for myself. With that being said, Jennifer, I want to thank you so much for being on Please Me today. Thanks for joining me.
Thank you again for having me.
It's been a pleasure. Until next time.
Bye.
Are you looking for a sexy date? Look no further than SDC.com. SDC.com is the premier ethically non-monogamous website that is worldwide. It also hosts a wealth of information on sexuality and sexual health, and I host a free live webinar monthly on the site. You can use code 37340 for a free trial membership on me. And be sure to reach out on the site and say hello.
I want to personally invite you to join me on Patreon for ad-free listening, bonus episodes, and early releases. Already there is a lot of bonus content on there with many webinars that I've done in the past and a show that I've never released to the public before. My show is completely self-funded, and when you are able to support me in this way, I'm able to spread my message of body positivity, self-love, and women's empowerment, and empowerment in general around sexuality around the globe. And so with that being said, I appreciate everyone who has already joined Patreon. And if you've thought about joining, now's your nudge to do so.
Greenlight helps kids learn about money by actually using it. It's a debit card and money app that teaches kids to earn, save, and spend in real life, not just swipe and hope for the best. Learning happens naturally, in the moment. Parents can set limits, see real-time spending, and guide better habits all in one place without constant check-ins or cash runs. Don't wait. Try Greenlight risk-free today at greenlight.com/trygreenlight.
Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.